Hi everyone, welcome back. We're going to begin with chapter 6. So this is different because we just got done with chapter 3 and I know we're working on chapter 13. I get it. But chapter 6 is going to be a very long chapter and it's going to be a simultaneous thing that we're going to work on at the same time along with the rest of the chapters that we'll be going through. So if you go to my iLearn site, okay, Adult Ed, Allied Health, okay, drop down, okay, down here, these are all the chapters that we're going to go through, kind of in order. 6 is the only one that's a little out of order, but click on chapter 6. You can click on the abbreviations chart 1. We have chapter 6 split up into 11 different charts, and we do this because it's impossible for you guys to memorize and learn over 400 different abbreviations and utilize them properly just straight, right? So we break it up into 11. Each of them has roughly 40 to 43 different abbreviations on them to learn. So the book has kind of outlined all these different abbreviations that you may use in some form or fashion in various parts of healthcare. So I have on this screen, okay, I found, all right, this is your chapter 6, chart 1, okay. So we'll start with the beginning. If you have an asterisk, okay, that's an asterisk. If you look at your keyboard, if you click Shift 8, that gives you an asterisk. Okay, that means at. We've all seen the A with the circle around it. I don't really know the technical name for it, but that we've seen all the time in email addresses, so that should be pretty self-explanatory. Both of those mean at. If you have an A with a line over it, that means before. So we're talking before you eat, before you sleep, before something, right? This could be taking medications. It could be stretch before you sleep, exercise before you eat, what have you. A and D is admission and discharge. So if you work in health informatics jobs where you manage admissions for a hospital, or maybe you're a unit clerk, something like that, you may be in charge of admission and discharge paperwork. A and P, this is anterior and posterior. So front and back. Anterior, think ante means before. Posterior, post means behind or after. So anterior is the front that comes first, and then posterior is the back that comes last. Anatomy and physiology can also be abbreviated as A and P. Physiology is function of parts of your body. Anatomy is the structure of different parts of your body. So A and P, generally there's whole classes called A and P. I took A and P 1 and 2 in college. So it's imperative if you're going into the medical field to know what A and P is. If you have 2 A's in a row with the line over both of them, that means of each. So this could be medications, like you need 2 of each pill, something like that. AB, now this is with a capital A and a lowercase b. Usually when you see a capital and then a lowercase, it's going to mean it's an element from the periodic table, like magnesium or potassium, hydrogen, oxygen, nitrogen, that kind of thing. But in this case, that's not really the case. So capital A, lowercase b, this is abortion, which means a loss of a baby before birth. Now, this can be spontaneous, where it's a miscarriage. A miscarriage is a spontaneous abortion. That is the technical term for it. If you decide to terminate a pregnancy, you can have a voluntary abortion done, and there's different words for different ones of those. So just make sure you know it's capital A, lowercase b. Abortion does not always mean, voluntarily killing a baby. it could be a spontaneous abortion. And AB with the capital A could be that. ABD, this is abdomen or abdominal. Your abdominal region is below your diaphragm, so below your rib cage, and above the bottom of your pelvis. So that's your abdominal region. That can be split into quadrants. It can be split into 9 different sections. But generally, when you talk about having abdominal pain, that's a pretty large area to just say, I have abdominal pain, right? In the medical field, you're going to say, okay, do you have right upper abdominal pain or lower right abdominal pain, right? You need to specify what area because you have different organs in different parts of your abdomen, and it kind of gives you a better clue as to what's going on. But abdomen can be abbreviated as ABD. ABG, so this is arterial blood gas, and I want to show you a video regarding arterial blood gas because I think I can't really do it justice. Okay, this video is really in depth, but we're only going to play the first 5 minutes, and that just gives you the basics to let you know what ABG actually is.
What is going on, guys? Don checking in. Welcome to Mint, where we bring nursing to you. So today we are going to talk about the easiest way to interpret your arterial blood gases. So if you're ready, we're ready. Let's go. Hello, this is the 3-step ABG interpretation. But before we dive into the actual steps, let us talk about basic concepts that you need to know for this lecture. Starting with, what is ABG? ABG stands for arterial blood gases. Arterial blood gases are simply the measurements of the acidity or alkalinity of the arterial circulation. It also measures gases such as oxygen and carbon dioxide. Now, we are going to talk about 4 important components that are in your ABG, and those are your pH, your CO2 or carbon dioxide, your HCO3 or bicarbonate, your PaO2 or oxygen. And we're going to talk about them one by one, starting with your pH. The pH is pretty much the measurement of how acidic or alkalotic the blood is. Your normal value for your pH is 7.35 to 7.45. And we're going to talk about the significance of these numbers later on. Next component would be your PaCO2. Your PaCO2 is pretty much the measurement of carbon dioxide, and our normal value for this is 35 to 45. Now, it is easy to remember 35 to 45 because if you look at our pH, your pH is 7.35 to 7.45. So just remember, 35 to 45 for carbon dioxide. Another concept that I need you guys to remember about PaCO2 or carbon dioxide is that it is being controlled by your lungs. Of course, we breathe out carbon dioxide. Another thing that I want you to relate with carbon dioxide would be acid. Now, I'm not saying that carbon dioxide is an acid. What we're trying to get here is that the amount of carbon dioxide is directly proportional to the number of hydrogen ions being produced, which is related to acid. We are not going to discuss biochemistry here, but all I'm saying is that the more carbon dioxide you have in your blood, the more acidic your blood is. If you look at your normal value here, 35 to 45, if your number is above 45, which indicates that there is more carbon dioxide in your blood, then your blood tends to be on the acidic side. On the other hand, if your value is less than 35, your blood tends to be on the basic side. Next up is your HCO3. Your HCO3 is your bicarbonate. Your normal value for your bicarbonate is 22 to 26. The bicarbonate is being controlled by your kidneys. And just to maintain the pH within the normal range, your lungs and your kidneys tend to work hand in hand to maintain a pH of 7.35 to 7.45. And we will talk about that later on today when we talk about compensation. Earlier, I mentioned that when you see carbon dioxide, relate that with acid. If you see bicarbonate, think about base. The more bicarbonate you have in your blood, the more basic your blood is. If your bicarbonate is more than 26, your blood tends to be on the basic side. On the other hand, if it's less than 22, that means you don't have enough bicarbonate in your blood. Your blood tends to be on the acidic side. Lastly, is your PaO2 or oxygen. This is also being regulated by our lungs, and our normal value for this is 80 to 100. Now, although this is important for us to check when reading our patient's ABG, we don't really need the number when it comes to interpreting whether your patient is having respiratory or metabolic, acidosis or alkalosis. This simply will tell us whether your patient is having hypoxemia or not. But am I saying disregard PaO2 all completely? Of course not. Just for the sake of the lecture, when you need to interpret your ABG, whether it's metabolic or respiratory, acidosis or alkalosis, you just need to look at your pH, your PaCO2, and your HCO3. Does your patient have hypoxemia? Look at the PaO2. Again, your pH refers to the acidity or alkalinity of your blood, and the normal value is 7.35 to 7.45. Your PaCO2 is your carbon dioxide, which
Okay. So that gives you some of the basics about arterial blood gases, what they are, and what the tests are used to find. So that kind of concludes the first video, but we will pick up with AC on the next one.